Sarah, I think you're on mute.
Oh, sorry guys, apologies. Thank you very much for joining us all today. Welcome to this spotlight session. Appreciate you taking the time over lunchtime to come in and see our stories and see what we've got to talk about. Thank you to our panelists who we'll introduce in a moment. And welcome to the session today. So the session today is a focus around workforce productivity and efficiency. And so specifically looking at insights and how they can be used to locate and quantify how and where we can identify workforce productivity and efficiency opportunities, and also how they can be used in supporting in building of a case for change. And so we're going to have a little look at the value of diagnostic insights and some of the holistic approaches that we use across the organisations that we've been working with around optimising your workforce. But also then looking at some of the cultural changes and the experiences of some of the local organisations to us around how they've managed to successfully deliver and embed change to support successful delivery of their workforce optimisation plans. So just in terms of introductions, welcome, my name is Sarah Reid. I'm Deputy Director for People Solutions from SCW. We've also got with us today Austin Morgan, who's our Workforce Programme Manager, and Mike Rees from our financial consultancy space, both from SCW. We're also welcoming Tina Ricketts, who's a Chief People Officer at University Hospitals Dorset, and also Eugenie Mellon and Alfredo Thompson. So Eugenie is Associate Director for People, Capacity and Talent Acquisition, and Alfredo is Chief People Officer at the Royal United Hospitals in Bath. So welcome to everyone today. In terms of the context and why we're talking about kind of workforce productivity, there's obviously a lot going on in the moment in terms of kind of challenges, a lot of productivity demands, spending reviews, and obviously the Darcy report published over the last few days. And for the last few years, SCW, we've been working with system partners from local providers to provider collaboratives and also kind of regional groups, originally focusing around how organisations can reduce their agency spend and their high cost agency spend. And so our methodology takes a very holistic approach to this. So it looks at the broad kind of drivers and influences that cause a general need for temporary staffing, as well as the need for agency spend and high cost agency spend, as well as bank. And so the schematic that's up at the moment shows the pillars through which we explore our kind of drivers and influences for the need for wider temporary staffing. From ensuring kind of effective commercial governance to looking at things like local culture and management practices in terms of things like leave management, e-rostering, recruitment processes, but also looking at kind of closing the gap in the demand and looking at kind of reducing the overall need, whether it's through things like skill mixing, whether it's through things like improving time to hire, and widening the candidate and participation pipeline, and then also helping organisations to work better together, so working across systems to optimise the utilisation of our staffing. And we had some reflections, and there was a blog you may have seen around Malcolm Gladwell. I don't know if you've read his book Outliers. He talks about the fact that plane crashes are not caused by just one fault, but they're caused by a series of failures that happen together. And from our perspective, when we're looking at workforce productivity and efficiency, and when we're looking at things like high cost agency spend, we find it that it's quite similar. You know, there's a real holistic approach to why there's a need. And there's a very holistic and quite complicated and complex solutions to optimising workforce and looking at kind of wider workforce productivity and efficiency. And we got to the space where we recognised that actually when we were supporting organisations in looking at temporary staffing spend and optimisation of temporary staffing, that actually this was a symptom of wider workforce productivity and efficiency challenges. And so a lot of the approaches that we're using with organisations at the moment and looking at things like at-scale people services, you know, they're very similar approaches that we've used in lots of our high-cost agency spend reduction conversations. We're seeing that lots of organisations are doing a lot of work of this already. You know, lots of this is not new. It's been going on for, you know, people have been working on this for a long time. But often it's not being looked at holistically, and it's not being kind of optimised across all lenses. And hence with our schematic here, we we try and support organisations in looking more roundedly and holistically across a variety of lenses to make sure that when you're looking at optimising and effectively using the range of the workforce that you've got available, that we look across the breadth of that. And part of the challenge we're finding as well for organisations, obviously with a tough financial climate, that actually it's very difficult to know where to focus your energy and your efforts when you're doing kind of workforce transformational pieces around workforce productivity and efficiency. And so it can be really difficult to quantify realistically the impacts that the transformational programmes that you might be delivering may have. But also we're finding for organisations that getting, board sign-off for business cases can be very challenging as well. So we're hoping that during today's session, we can give you some ideas and insights from our kind of collective experiences and from the various organisations who've joined us today, who've explored their kind of wider approach to workforce productivity and efficiency and the challenges that they've faced. So I'm going to hand over to Austin, who's going to talk to you a little bit more around the power of the diagnostic insights.
Thanks, Sarah. Thanks for taking us through those slides. To start with the structure of the approach, what does a productivity and efficiency program look like to us in real terms? So our approach to all our productivity and efficiency programs starts with the diagnostics. We need to understand where your baseline data and current position sits before we can begin to assess where improvements could be made. So that diagnostic phase could be a high-level assessment of the size of the prize available, sort of quantifying the art of the possible. Or a full-scale deep dive diagnostic that we can tailor depending on the requirements and the time available. From there, we move into our validation phase, so ensuring our findings accurately represent reality and doing that in conjunction with the appropriate stakeholders within that program, ensuring there's no crossover and dependencies between each area that we counteract, and making sure that we don't double count any savings within them. So the implementation phase then is where we work with our stakeholders to develop delivery plans, work packages or business cases to ensure that the efficiencies are implementable and sustainable. So at this stage, we may also be responsible for delivering, depending on requirements. As an approach, it's very customizable to meet the needs of the program or the client. And then finally, tracking those benefits in the assurance stage. So have the improvements done what they were designed to do? And have any changes been sustainable? It's important that any improvements or efficiencies are sustainable for the long term. So this slide is very much quantifying the art of the possible, and you see the sort of buckets we might look at in terms of where savings or efficiencies could be made. So in terms of quantifying the art of the possible, it's that size of the prize assessment. So this example is based on a methodology that we've developed to derive headline figures with broad headings to provide that steer and demonstrate where there's clear evidence for efficiencies and cost savings available. My colleague Michael will take you through the analysis in later slides, providing more context as to how those figures were arrived at, and a more detailed example outlining assumptions and dependencies. So the methodology that we use to arrive at these figures is based on quite a non-interventional approach to diagnostics. So it would require limited engagement from a client or group of stakeholders at this stage, and it's based around data that's accessible to us. The diagnostics then delivered with translation and wraparound narrative and context. So this is a really good first step to provide that strategic direction steer for what we would then call deep dives as a next step. So we've used these headline figures to develop deep dive programs of work that look at each area holistically, so quantitatively, qualitatively, providing that detailed recommendations, delivery plans, and additionally, for us to deliver transformational requirements on the behalf of the end client if that's what's required. So if we're going to look at maybe even just one element within that, something like time to hire, that's a measurement that quantifies the cost of time to hire in relation to the cost of temporary staffing coverage, say against a set KPI. So simply put, if it takes 20 days longer than average or a target to hire, how much will that cost to cover that work? That set KPI could be a comparator organization, national average, or an aspirational target that's set within the organization. In a deep dive program, that would involve a full end-to-end process mapping, as well as system and policy reviews. It would involve structured interviews with key stakeholders, really to pinpoint the bottlenecks and the pain points that would ultimately contribute to increased time to hire. Where we do identify an area for improvement, it's measured to understand what its contribution is to the overall time to hire, and then interventions are identified, scoped, designed, costed, and netted out against the headline opportunity to provide a validated cost improvement. That can also include a full delivery plan, and potential resource for each intervention dependent on the requirements. In broader efficiency programs, that's also examined in conjunction with any other interventions that are being proposed to identify those areas where there's a potential for double accounting. This type of work on time to hire could ultimately lead to, for example, a business case for a different resourcing model, or potentially support the implementation of new systems or policies. It's a versatile, scalable model of support and can be utilised by individual organisations through to systems or provider collaboratives. And we're currently using a similar methodology to evaluate service design and target operating models for at-scale people services. So I'll hand you over to my colleague, Michael.
Yeah, so as Sarah mentioned at the start, my name is Mike Rees. I'm head of financial consultancy here at SCW, and Sarah, Austin and I have sort of formed a bit of a crack team and worked together on a number of successful programs over the last couple of years. And in the background of the majority of transformation programs, we find is a financial challenge. And what our customers have told us is that they really value the credibility that the connection between workforce colleagues and that expertise and my team's accounting and finance background brings. Finance teams are busy. It's a challenging time. We are able to engage early and build relationships with those colleagues and ensure the data is available, and where required, assumptions within calculations are agreed as we progress, and that everyone's happy with how we're calculating our high level assumptions at the very start in the diagnostic. This slide shows the transparency of a scenario model which we put together in a previous program. It's just to give you an example of the type of information that we give, and it states the assumptions up front. It details the calculations, states the risk adjustment factor we've used. This is a diagnostic stage, so we're often working with aggregated data and need to take account of that, and that's what that does. The key to that being successful is that we all agree those assumptions up front, and there's an openness around them, and you know, sort of a workshop approach in our collaborative approach to make sure that everyone's happy with what we're stating up front as our size of the prize assessment, and then we move into that validation stage. And that validation stage uses more granular data, for example, full ledger downloads, to ensure that the costs that we've got in the accessible data are right. And the key element is some interventions may intersect each other, and so this needs to be taken into account when we get to that validation stage, and that's the aim of that. And from there we move into business case support, and my team's focus clearly is the finance and economic case of any business case that we put together, but we're able to support the other three cases as well. The majority of our team are better business case trained. And the benefits realization portion of our approach as well ensures that decisions made of the desired outcome, and we've got benefit models that we've developed for both individual organisation, system and national level programs that have been successful. So I'll hand back to Sarah because we're going to run through some examples from people we've worked with.
Thanks, Mike, and thanks, Austin, for running us through some of the technicalities of the diagnostics. So going to reach over to Tina, and Tina, I know you've used this sort of diagnostic approach in a couple of organisations to help develop data and insights-driven strategy. Keen to kind of know how this kind of data-driven approach has supported you and your strategic planning and development of any kind of cases for change.
Yes, sure. So Tina Ricketts, Chief People Officer, University Hospitals Dorset. I've also used it in my previous organisation. Helpfully, having the CSU support this work gives that independent look into towards the organisation, and benchmarking using the model system, but also we were able to give them other trusts that we wanted to be benchmarked against, which we felt were similar. So that was a helpful comparison for us. I often get asked at board about, have we got the right size, cost-effective workforce? And I was able to answer that exam question with the information that was provided through this insight work. The outputs in my current trust are in front of you on the slide here. And so what the bullet points you'll see is the areas of opportunity identified from that insight work. And then I'm a bit of an anorak, so you'll see a colour coding, but the colour coding at the bottom, the key is, so the purple ones is what's going to help me with my future workforce planning. And some of that work is transformational or high impact. What's going to help with making sure I've got the safest staffing models within my current trust. what's going to help me further reduce my premium staffing costs. The green ones is how we're going to organise our staff in the right way to have the highest impact. And the other is around how we can increase our productivity. And so this development plan on a page will be an integral part to our operational plan for this year and next year. And so we've got in brackets the lead for each of those programmes of work. So Chief Medical Officer, Chief Operating Officer, and so forth. And so this has been a real helpful exercise for me to be able to then have this plan to use going forward. Thank you.
Thank you, Tina. And we often get asked when we're speaking with organisations, they, as we know, have done an awful lot of work on all of this already. As we said earlier, it's not necessarily new stuff. But we find often that we speak to organisations, we help to identify, as Mike and Austin talked through, those kind of top level opportunities and the kind of the art of the possible, really, from that kind of financial perspective, with the insights from the workforce teams around kind of practical implementation. And so we find often that organisations have identified opportunities for transformation to support workforce productivity and efficiency, but they often can really struggle to embed the change longer term. So I wanted to bring in Eugenie and Alfredo from the Royal United Hospitals in Bath. So I know you guys have had some really fantastic tangible outcomes in terms of areas like theatres and agency spend, and are looking at things like pay bill reduction. What's worked well for you guys, and what lessons have you learned kind of throughout your journey?
Yeah, so we've got some slides to talk you through our journey. So our starting point's probably much like other people. Our agency spend was unsustainable. We had compliance that we wanted to improve. And there was a greater need really for grip and control was our starting point. In terms of our approach, we recognised that high-cost agency spend was a symptom of not having a number of elements in place to be able to support our people and our hospitals to get the best outcomes. So on the next slide, so what we did to approach it is we kind of had a blank piece of paper. We looked at all of the elements that we felt would drive the change we wanted to see, and then we kind of questioned and challenged ourselves around what were the initiatives, what would they impact, and how would that be better for our hospitals? So from a procurement perspective, we quickly realised that the suppliers that we were working with, they were not actually supporting our compliance in terms of price cap or framework. So we knew that there was a whole element of work to do there. And also collaborative, what could we do collaboratively to drive some change? From a technology perspective, we recognised that we'd made a huge investment into lots of systems, and we wanted to make sure that was working really hard for us, from a user perspective, as well as that kind of reporting data and outputs. So some of the kind of things we did on a people level were around wage stream, supporting people's financial well-being, being able to access their earnings earlier, working closely with partners like Locums Nurse. What could we do collaboratively? That would reduce our agency spend. It would increase the experience for our medical and dental workers. It creates efficiencies. From a leadership perspective, it was really clear that we needed our exec team to have oversight. We needed them to be part of the escalation process, and we needed them to see it as a priority and help drive these metrics around price cap, off framework, proportions of pay bills. And when it came into the control place as well, it was around the exec team being visible in the vacancy control panel space, being able to kind of scrutinise and right-size our workforce. We've had some really successful outputs from there. With regards to the controls, it was looking at what we had in place and what could we actually improve. Rostering, we had it, but it wasn't consistently being used across our trust. So therefore, having KPI meetings, checking and challenging our audits, they were all very simple things that would support a culture of change. And then on an engagement perspective, we really wanted to focus on our people-friendly processes. What did we need to do to consistently get the basics right for our people? We wanted it to be easy to join our bank. We wanted to be able to have weekly pay. So, we kind of compete with agencies. We wanted to make sure that auto-enrollment was there. So when people wanted to work for us, they were all signed up and ready to go. We didn't have any delays in our processes. And we needed to wrap around our corporate functions, around our managers. How do we help them understand their budgets, their establishments, their recruitment, their workforce planning? It was a holistic approach of support to make sure that they could get the best outcomes. So on the next slide, we just want to kind of cover off what has been our impact. So from the metric point of view nationally, our proportion of the pay bill last month was 0.9%. So well within that national target of 3.2. We're no longer an outlier with regards to off-framework usage. And with regards to price cap compliance, we are price cap compliant for all staff groups, excluding medical and dental, which is a shared position in the region, although there is work going on that's incrementally progressing us to that point. And that's through things such as the South West rate card. So when we've looked at our same month from August last year to our position in August this year, you can see that our agency usage has reduced from 138.9 whole-time equivalents down to 21 whole-time equivalents. So in comparison of months, that's an 85% reduction. Our agency spend, obviously, is going to decrease because we're using less workers, but we're also paying less for the same. So the workers that we have got, they're now price compliant. They are now framework. So we're getting better value for money. With regards to overtime, previously, you can see in August last year, we had 89.1 whole-time equivalents. In August last month, we had just 1. So that's a 99% decrease in terms of overtime. We have pretty much switched off overtime. We have moved that over to bank to support best value ways of working. A new hire attrition I've put in here because it just shows that you can't do this in sort of isolation. It's not a silo piece of work looking at agency spend. So we've done a huge amount of transformation work in our recruitment service to make sure that we've reduced time to hire and we've got a better talent acquisition approach. The new hire attrition, when we looked over the financial years, we've managed to decrease that by 50%. But if we look at it from a comparison of August last year and August this year, you can see that we decreased it in month by 68%, which means that who we attract, we are now retaining, which means that there is less reliance on temporary staffing because we're holding on to our workers. So very happy to take any questions, but our takeaway points, the things that we think really made a difference to us, was to be agile and actively listen to people. We didn't always get it right first time. Some of the changes weren't always popular, but listen, co-create with our workers. That will be the things that drive us forward. Exec sponsorship has been the thing for me in my role that's really made a difference. And I think having them see it as a priority and drive the change has been really influential to other people. And designing people-friendly process, it helps with engagement. If we can make it easy for them to get the best outcomes, they'll engage. And I guess the one thing to share is it's not one secret ingredient that will give you these incremental reductions. It's pulling multiple levers, so having multiple initiatives in place to remedy the symptom of the high-cost agency spend. I don't know if you want to add anything, Alfredo.
Thank you, Eugenie. I think it's been, as you've said, we've made lots of mistakes. Lots of what we're doing isn't necessarily things that other colleagues aren't doing. I think it's the combination of combining all of them and working together in the organization. I think for me, reflecting on this, I think the secret is the partnership that exists between the People Directorate, the Chief Operating Officer, and the Chief Nursing and Medical Officers is really important in driving some of this as well, just in terms of financial impact for those of you who are interested in that sort of outcome. So in month 5, which I believe is August, if memory serves me right, we've already delivered £6.6 million pay bill reduction savings. That's circa the tune of 179 full-time equivalents. A reduction completely. We have more to go. Like Eugenie said, we didn't all get it right. We didn't always get it right. There is that always the tension between controlling pay bill and impacting on in terms of performance and activity. So that would be my advice. Look out for that as well. Thank you.
Thank you both, and thank you for sharing your experiences. I know when we've talked before, you know, it's a conversation I think we could have for hours, because there's so much that you guys have been working on, and such, you know, such interesting kind of stories and experiences. Just wanted to reach out, and I can't see any questions in the chat, but just to ask any of our attendees if there's any particular questions, kind of having listened through this. I think for us, as we say, you know, I think we've all touched on that you know, the focus around workforce productivity, looking at that kind of database and driven, but also looking very holistically. It's interesting, Eugenie used very similar language to me in terms of it being a symptom. So when we talk about high cost agency spend being a symptom of wider workforce productivity and efficiency, and actually for organisations who've been focusing on that for a while, how can we use the learnings that we've had from when we're looking at agency spend reduction to actually look at workforce productivity and efficiency through a slightly different lens as well. So it's kind of really interesting to see all of that start to come together. So any questions from any of our attendees? Can't see any hands going up. Please do flag NHS providers team if I'm missing any hands going up. Okay. I think whilst we're waiting for any questions to come through, I suppose I'd just like to maybe ask Eugenie and Tina and maybe Austin, what's next? What's next? What do you think you'll be looking at next? You know, based on the journey that you've been on and the challenges you've been looking at so far. Where's your kind of what's next in terms of the areas of focus that you guys think you might be looking at moving forwards? So Eugenie.
So for us, it's around bank rates is probably our next biggest piece of work. We don't want to do things in isolation. We want to work really collaboratively with our region and our partners. We don't want to create inadvertently another market of competition, because I think that's where we were on an agency. People were, you know, chasing the rate, and now we just want to make sure that we can do some collaborative work around our bank rates as well, so that we keep ourselves stable and safe.
Thank you. And Tina, what's next in terms of your areas of focus, being on the journey that you've been on so far?
Yeah, so what I shared with you, the plan on the page earlier, was just within our own organisational boundaries. So what we can do internally to make sure our workforce is as efficient as possible. But the next step of work for me is how I work across the Dorset with my provider collaborative partner organisations, and about how we can make the workforce efficient across those. And obviously within the Darcy report, there's that shift to community and primary care, and the workforce, you know, and how that might impact the workforce going forward. So I think it's first of all, we have to get our own house in order, understand our workforce, and where we need to realise those opportunities, which is that sort of summary plan on the page. And then the next step to me would be then working across those organisational boundaries, and where it makes sense for us to work on some of those programmes of work together.
That's great, and I think be really interested to see where all of that goes. You know, I know lots of us have been around when we've looked at care closer to home and optimising community services before, so it'd be interesting to see where that goes. And Austin, I know you've been doing work with other organisations that we haven't really touched on here around kind of medical workforce and medical workforce optimisation. Would you like to just briefly touch on that as well?
Yeah, absolutely. I do think medical workforce optimization is going to be something that we really look into quite deeply over the next, well, I'd say 6 months, but it's probably going to be more like 18 months. We're working on a number of different models and products around getting the most out of your medical workforce, whether that be from that whole process, end-to-end review, but really around the e-job planning element of it, making sure that each job plan is representative, team-based, and gets the right activity out of it, ensuring that we're not baking in inefficiencies, and moving it more towards those 7-day consultant service models. So there's some interesting work coming up there.
Thanks, Austin. I know that's been really interesting, looking at the baking in particularly, and using, you know, effective baseline data and some of the discrepancies that come up when you're looking at kind of medical workforce figures and assumptions around that, and how that gets baked in, not only into recruitment, but also into temporary staffing and other kind of more strategic kind of workforce planning approaches when you're looking at that workforce specifically. So it'd be interesting to see that coming forwards. Okay. Just to say a big thank you. I can't see that we've got any other questions or queries coming in through the chat. Please do let me know if raise your hand or shout if there's anything else you'd like to ask. We will ask the panelists to wait on for another 10 minutes or so in case people want to ask anything as they're coming off. We have provided some contact information again if you'd like to reach out to any of us to talk about our experiences or for us to share some of our learnings and further insights. I appreciate this is a very short session and just gives you brief introductions to some of the approaches that are being used in different organisations across the system. But I think we're all very keen to share and share our experiences as well. A big thank you to our panelists today and to the NHS providers team for facilitating this. And I think that the power of having different organisations coming together and sharing their learning and experiences is immense, and it can be really transformational when we're looking across provider collaboratives, across systems, and sharing across regions. So just a big thank you to everyone for joining, and thank you for those who joined us from Dorset and from the IOH in Bath as well for sharing your experiences with us. So we'll hold on for a couple of minutes. If you do have any questions, please do feel free to shout. But if not, then I hope this was helpful, and I hope you have a lovely rest of the day. Thank you for joining us. Doesn't look like we're getting any further questions. If it's okay, we'll stop sharing and close the call down. Thanks very much.